Fedi here. If you don't know who I am, my best friend's life, Collier, my best friend's life changed forever when he met the right dentist, had orthodontics treatment. So I'm on a mission to help as many dentists as possible, work with as many patients as possible to help those people also change their lives. And in today's video, I'm going to specify exactly why some people are simply not becoming a patient. In the sense that the reason that you have people that are in your local area that are looking for a dentist but never go to your practice, for example. Honestly, it's quite simple and it's quite direct, but I'm going to break it down into 3 stages. So the first stage is research. The second stage is gathering information, which is part of the research process, but it's slightly different. And then the third one is reaching out, right? And it's in either one of those 3 stages that you tend to lose potential patients. So for example, in the first stage of research, this is where people will go on Google, or where people will look up in their directory. Well, not a lot of people still have a local directory. I'm pretty sure I have one here, Denton's. But this is where people will go on their directory, or mostly online, and do research, right? This is where they'll research about their problem or what they need. If they go to the directory, again, it's quite direct, no pun intended, but online, and I'm going to focus on the online bit. Online, people are going to look up, for example, do I need a filling? And then they'll list their symptoms. Or my gums are hurting, what are the solutions? And then they might get implants as one of the solutions. So in that research process, that's when they usually find either the solution to their problem, or that's when they find a symptom that they wouldn't necessarily be able to diagnose themselves, they've just realized about now. So it's going to usually be in this process of research where they attempt to get more information about either the certain treatment or the certain, process that they need to undergo to fix their issue. I'll give you an example, sticking with the implants one. So people might look and, get more information on how implants work, how much they cost, where they could usually get them, if they could get them with their local dentist, if they need a specialist, which they do, but if they need a specialist, anything like that, right? Anything that helps them gather more information that isn't necessarily research on the solution, but it's more so research and getting information on the solution itself. If that makes sense. I know I explained it kind of weirdly, but if the first step is research into their problem, and then the second step is getting more information about the solution, then this third step is knowing where the solution is knowing the root of the problem and getting it fixed. And this is where I'm going to focus for the next 5 minutes or so of the video, because this is really, really important. Basically, people nowadays have 2 ways of getting a hold of dental practice. The first one is by email, that they can usually find on the website, and then the second one is by number, again either found on the website or found on the Google review, right, on the Google page or on the Google My Business page. If we go down the route of email, the response rate via email is not incredibly high. There's some people in situations where their emails either go to spam, or they usually don't communicate their issue properly. And so if they don't receive an email returned in, off the top of my head, I think it was people check their emails 2 or 3 times a week. And if they don't receive a response within the times they check them, so let's say someone sent an email on Monday, and their next check was just randomly on Tuesday, but they still hadn't received a response from your practice, then what they're going to do is assume there will be no response and look somewhere else. Same way if, let's say, they reached out to 2 different practices on Monday, and then by Wednesday, yours replied, but the other one didn't, then they will assume that the other one won't reply and there's no point in waiting for that reply, and they'll go with you. So basically, people go for the easier route. So in email, you want to make sure the responses are speedy, and you want to make sure you get someone on the phone as soon as possible. Of course, there's a caveat to that. You might get someone on the phone and they simply don't pick up, right? Or you might get someone on the phone and they just change their mind. But the point is, you want to be really quick with the responses, and you want to be constantly available, because guess what? People, we live in a world nowadays where everything is instant, right? Literally, Amazon put the standard where you get next day delivery. It could be 9 p.m. the day before, and you're wanting to order something, and then Amazon will get it to you in the morning or in the afternoon. Point is, the next day. So when people are surrounded by this instant gratification, when they're surrounded by this instant response, how do you think they'll react to not being responded to or not being tailored to straight away with something as important as an implant? Right, because usually their gums are going to hurt, they struggle eating, they don't feel confident with their smile. They just want to fix the problem as soon as possible, because they did the research, they found out what their problem was, they found the solution, they gathered more information about the solution, and now they're wanting to fix that problem. Secondly, with the phone, what you tend to have is busy periods, of course, in every practice, and you can't always pick up the phone. That's normal, right? There's nothing necessarily wrong with that. A lot of the time, some receptionists don't answer the phone in the most, not unpolite, they're always polite, but not in the most enthusiastic way. And they don't necessarily solve or help educate the patient to solve the issue. That is a topic for a different video, in terms of having the most efficient salespeople at the front desk, the receptionists. And kind of the system they should be using and how they should be doing things to make sure that as many people that do go on the phone become patients straight away. And secondly, the phone isn't picked up. And when the phone isn't picked up, the person will simply go on their computer. Bam. They will look up dental implants near me. They got your practice, they called your practice, nobody picked up. So what do they do now? They simply scroll down, go to the next practice, and look at that. That practice picked up and they have a new patient. You see, the issue there was, it's not that you weren't omnipresent, right? We can't always be on the phone all the time, constantly waiting for a call. But what you can do is have a system in place, an autoresponder, as I call it, where your patients, or potential patients in this case, are automatically sent a response when you miss a call from them. So an example of this would be, I'm calling. Bing, bing, bing. Ring, ring, ring. Sorry, we can't answer the phone right now. Our team is chock-a-blocked. I hang up. Let's say I was doing it on my mobile phone. Sorry, that was terrible, by the way. Let's say I do it on my mobile phone. Yep. And then instantly, I get a message saying, this is XYZ dental practice. I apologize we couldn't get to the phone in time. Please pop us a message as to why you were calling. This literally solves the issue of them going to the next practice, because now they have a way of communicating with you, whether there's someone on the other side or not. I can explain that later, but they now have a way of communicating with you. Hi, yeah, I've had really sore gums recently, and I've had loads of struggles with chewing. It hurts, and honestly, it's not very confident when I smile. I doubt they're going to open that much, but I'm looking into implants. Does your dental practice, or does your dentist offer this? Now, you don't have to respond instantly in that case, because they've satisfied their urge of simply reaching out and being heard or listened to, right? Preferably, you reply to that as soon as possible. But basically now you have a sort of commitment from that patient, because they're not going to think, oh, okay, now I'm just going to call up a different practice and see what they say, because SMS is nothing like email. And I don't want to go into the psychology of it because it's really cool, but it's not really that, you know, not that relevant to the video in terms of how it works. But people are more committed to a text message than they are to an email. So now they've committed themselves, shared information with you in hopes that you will respond as soon as possible. And when you see that message, you can either call them back, same way as you would have done if you saw a missed call. The only difference is now, when you call back after the missed call, 9 times out of 10, they would have not looked anywhere else. Boom, problem solved, if you ask me. So I don't want to just make the video and give you the solution. I want to give you the proper solution how to do this. There's a software called Go High Level, which we use for our clients, and that has an autoresponder that can also recognize certain messages. That way, you don't have to be constantly replying if they're following the same pattern, and you can have an auto response, right? But the main thing is having an auto response after a missed call. So if I were you, I'd use any software to do that. Right? We use Go High Level for our clients, but I use any software, because you will see the drastic difference between people who call and, you know, get a missed call and that you don't pick up, and those number of people will become your patients if you give them the option to respond. I can't stress that enough. People don't care anymore, right? In the sense that they have so many options. They have so many options to just, I'm in Bath, for example. I can just scroll down a tiny bit, find another good practice and just call them up. And look at that, their receptionist picked up and now I'm one of their patients. It's that simple, it's that easy, right? So the main thing to take away from this video is to understand what potential patients are doing, which is researching, then gathering information about the solution, and then reaching out to the local practices. And then what you can do is, one, make sure your receptionists are lovely people, which most of the time they are, right? And that even when energy is low, they still respond and are helpful. Secondly, you make sure that someone is on the phone all the time. Unrealistic, but if you can do it, great. Thirdly, and the most realistic one and the best one that goes hand in hand with the first one as well, is that having an autoresponder to missed calls. The main thing that's going to hold you back is not being available in these coming years, because people have more and more options, more and more NHS practices are transitioning into private. People are less and less committed to their practices and to their dentists if they find another solution, right? Or if their problem can't be fixed straight away. That's the reality of it. That's how it is. And you being available, you being able to just, hey, I'm here to help straight away, that's what's going to differentiate you and get you more patients. And this is effortless, this is cheap, and it's really easy to do, right? Effortless in the sense that you don't have to put that much effort, but easy just because it's easy, right? All you're doing is sending one message. That's automatic. So that's it. And by the way, if you are struggling with increasing your private patient base, especially with cosmetic treatments, then click the first link in the description. Don't worry, it's not a PDF file. It's not a quick guide. It's not like a video of me skimming and saying, hey, join my webinar. It's me in a short video explaining the problem and explaining the solution with the strategies. It is a funnel designed to sell you something. I'm not going to pretend it's not. To trap you and, you know, try and get you to click on it and then be like, ha, I'm selling you something now. So feel free to click it if you want. If not, I'm not too fast. That's absolutely fine. That's all for this video. Just reiterating the points a final time. People research, people gather information about the solution they found from their research, and then people reach out. If when people reach out, you aren't available, they swipe on to the next practice or they scroll down to the next practice. So have an autoresponder, because that is going to get a level of commitment from potential patients that you wouldn't normally get. That's all for the video again. If you enjoyed it, leave a like, subscribe for more videos like this where I kind of dive deep into problems, solutions. I'm wholly solution focused. And then, yeah, leave a comment if there's anything else you want me to cover. If not, that's absolutely fine. Leave a comment saying how great I am. No, I'm joking, but thank you so much for watching. Take care.